Do women experience hormonal changes during the menstrual cycle? What are the myths and realities of erectile dysfunction? Hello to all lovers of psychology and sexuality. Today, we will unveil the sexual curiosities of women. If you are interested in these topics, make sure to subscribe and activate the notification bell to not miss our future videos. Also, leave us comments and share your experiences in the section below. Let's get started. Yes, women experience hormonal changes during the menstrual cycle. Estrogen and progesterone levels fluctuate throughout the cycle, affecting sexual desire, vaginal lubrication, and other aspects of sexual response. Common myths about erectile dysfunction include that it only affects older men or that it is purely a psychological issue. The reality is that it can affect men of all ages and have both physical and psychological causes. Treatment is possible. Importance of consent. Consent is essential. Not all women enjoy anal sex, and it is fundamental to respect individual limits and desires. The importance of touch, physical contact, such as hugs and massages, releases oxytocin, the love hormone, promoting emotional bonding and intimacy in relationships. Influence of alcohol on sex. Alcohol can affect sexual function in various ways. While it may lower inhibitions, excessive alcohol can hinder erection in men and arousal in women. Sexual inhibitors. Some medications can have sexual side effects. Sexual inhibitors, such as some antidepressants, may reduce sexual desire or make arousal and orgasm more difficult. It is important to talk to a healthcare professional if experiencing these effects. Role-playing games are a common way to explore sexual fantasies. Couples can take on roles and scenarios to unleash their creativity and enhance sexual arousal. Kegel exercises. Kegel exercises are not only for women. Men can also benefit from strengthening the pelvic floor muscles to improve the quality of their orgasms and control ejaculation. Men in relationships tend to masturbate more than singles. This is because regular sexual activity can increase testosterone levels, thereby boosting sexual desire. This cycle is an interesting phenomenon that illustrates the relationship between sexual activity and body chemistry. Menopause and sexuality. Menopause can impact women's sexuality, causing symptoms like vaginal dryness and changes in sexual desire. Communication with a partner and medical attention can help address these changes. Women and pornography. The world of pornography is not exclusive to men. 1/3 of internet users visiting adult sites are women, and around 10 million women per month are interested in this content. A study by Glamour magazine reveals that 87% of women aged 25 to 39 enjoy porn as part of their sexual habits, although over 70% keep it a secret. Natural scents. A person's aroma, including their natural scent and chosen fragrances, can also influence attraction. Scent chemistry plays a role in physical attraction. Orgasm control. Some men practice orgasm control, also known as the edging method, which involves intentionally delaying orgasm to prolong sexual pleasure before allowing themselves to climax. Orgasmic dysfunction. The inability to reach orgasm, known as anorgasmia, can affect both men and women. This can be due to physical, emotional, or health-related factors and can be treated with the help of healthcare professionals. Cervical orgasm. For some women, the cervix becomes an erogenous zone during sex, and proper stimulation of this area can lead to intense cervical orgasms. Each person is different, and some may find this type of orgasm surprisingly pleasurable. Paraphilia refers to sexual attraction to unusual objects, situations, or activities. Examples include exhibitionism, voyeurism, and fetishism. Physical build. Some women may find different types of physique attractive, whether slender, athletic, or with a bit of weight, depending on personal preferences. Polyamory is a form of relationship in which individuals have multiple consensual partners. It can be an option for those who wish to explore intimate relationships with several people simultaneously. Post-experience. After anal sex, some people may experience temporary sensitivity or discomfort. Resting and caring for the area can help alleviate any discomfort. Postures and positioning. Experimenting with different postures and positions can influence comfort and pleasure during anal sex. Pseudocyesis, also known as psychological pregnancy, is a condition in which a person experiences pregnancy symptoms, such as abdominal weight gain and absence of menstruation, despite not being pregnant. This phenomenon is uncommon, but illustrates the mind's influence on the body. Refractory period. In contrast to women, most men experience a refractory period after orgasm, during which they cannot reach another orgasm or erection. The duration of this period can vary significantly among men. Relation to G-spot stimulation. Some women report that anal stimulation can have indirect effects on G-spot stimulation and increase orgasm intensity. Respect for limits. Respecting the partner's limits is fundamental. If someone does not feel comfortable or is not interested in trying anal sex, those limits should be respected. Nipples are a common erogenous zone in both men and women. Some people experience high sensitivity in their nipples, which can lead to orgasm with proper stimulation. Sex in water, whether in a pool, jacuzzi, or the sea, can be exciting. But it's important to remember that the body's natural lubricants can disappear in water, making sex uncomfortable. Additionally, water is not a good substitute for lubricant. Sex in the elderly. Sexuality in old age is an important part of life for many older individuals. Older couples can continue to enjoy an active and satisfying sex life. Sex and science, the science of sex, known as sexology, is a multidisciplinary field that explores human sexuality from a scientific perspective. Sexologists study a wide range of topics, from sexual anatomy to sexual therapy. Sex and heart health. Regular sex can be beneficial for heart health. It has been shown that regular sexual activity reduces the risk of cardiovascular disease. Sexual therapy for hypoactive sexual desire disorder focuses on addressing the lack of interest in sex by identifying emotional and physical factors that may be contributing. Simulated orgasm. While not exclusive to women, some may simulate an orgasm for various reasons, such as satisfying their partner or ending sexual activity. Open communication and intimacy in a relationship can help prevent this. Painful coitus syndrome, also known as dyspareunia, is a condition where a person experiences pain during intercourse. It can be caused by various reasons, such as medical, emotional, or physical issues. Spirituality. For some women, spirituality and the search for meaning in life are attractive qualities. Penis size. There is a wide variety in the size of male genital organs. Although the average is usually around 13 to 15 centimeters when erect, sizes vary significantly. Having a larger penis does not necessarily guarantee greater sexual pleasure for the partner, as satisfaction depends on other factors such as technique and communication. Time and patience. Anal sex requires time, patience, and gradualness. Rushing can result in discomfort or pain. Use of condoms. Using condoms during anal sex not only helps prevent STIs, but also facilitates cleaning after the activity. Variable times. The duration of orgasms in men can vary widely, from a few seconds to over a minute. Shorter and less intense orgasms are also possible. Benefits of morning sex. Having sex in the morning can have health benefits, such as reducing stress and improving mood. The release of oxytocin and endorphins during sex can provide an energy boost.